Hi, I'm Dr. Sireesha Reddy, Senior Consultant at Motherhood Hospitals, Hebbal. I've been with Motherhood Hospitals for the last 10 years, working at the Hebbal unit. Water birthing is a method of delivery where women uses water for pain relief during their labor process and also can use the water to deliver the baby. The benefit of water birthing is obviously the warmth of the water gives us a lot of pain relief. The buoyancy of the water helps the baby to descend down easily, and the perineal stretch is very minimal during water birth, and the baby tends to come into an environment which is more similar to what it has been inside the mother's womb. The baby lives in a water bag inside the mother's womb and it transits outside into the similar sort of environment, and you tend to notice the journey becomes much easier for the baby during that time period. Even though the water birthing has been in the systems for quite many years, I think it's from 1960s if I'm not wrong, people have started doing water birthing. But the momentum has peaked last few years, and in India obviously there's a lot of awareness that is coming up, and there are few centers all over India that do offer water birth as a part of natural birthing process. Water birthing, obviously it is just not something that you do it on your own. You need supporting system, supporting staff around you. Your doctors, your midwives should be in tune with the process and be the guiding force to you as well as be the supporting force to you. So when you're talking about the benefits for the mother, as we discussed earlier, the water is a very potent source of pain relief. Actually, it takes the pain away. Majority of the pain is taken away, the labor pain. And it's such a relaxing environment for the mother, and you tend to notice the labor also becomes slightly shorter when compared to while they are laboring out of the water as well. And the tears which we have noted, the perineal injuries are much lesser when they're in the water birth, and it's totally hands-free. It is, nobody is interfering with your body, and the baby is trying to just come through the process as natural as possible during the water birth. To the baby, the transit from the mother's womb, where the baby was already in a water bag, and coming out into an environment that is more or less in par with what was the environment inside the mother's womb, makes it more easier for the baby and causes less stress on the baby is what the evidence shows. The first and foremost thing is the mother should be chosen well. I mean, the candidate should be an ideal candidate. She should fit into the criteria for water birth. That's one thing. And the second thing is this should not be experimented in standalone units nor at homes where the support system is not robust. And in a hospital environment, if your doctor is able to provide you where immediate attendance from the pediatrician as well as the theatre is available, the anesthetists are available around, delivering in such an environment, the water birth would be the safest thing, because you're already screened well. They know your condition, they know the baby's condition, they know that you're a low risk mother who are fit to deliver without extra interventions and extra monitorings. I think that journey should give you a very least amount of risk or complications. In the water birthing or the natural birthing suite, it is just not a room alone. It is an environment that is, going to be calming you, helping you with the pain relief option, which is, non-medicated. So here what we try to provide you is with a birthing ball. There's a birthing chair, as well as aromatherapy that you can use for pain relief, and music that is there to calm you down. We do offer you what is called a TENS to relieve your pain, and the pool obviously for the hydrotherapy. You are free to take showers in between if you feel like having a warm shower. There are hot bags that are being used to help you out, and the supporting staff, a doula, will be there with you throughout your journey in the labor, as well as a midwife who will be monitoring your baby and your conditions. Your partner will be there throughout with you. The doctors obviously are there as non-interventional persons who are looking at, who are ensuring that the process is going extremely smooth and safe for you and for your baby. Once you're in active labor, that is you're closer to 5 centimeters and getting good contractions. Once you go there, obviously you're with the help of your doula as well as the midwife, you tend to go through all the exercises that help you to do that help the baby to position well in your pelvis and try to make the journey much easier and faster for you. And the water pool, obviously the water birthing pool is there, which you use for your pain relief in the initial stages. And as the labor progresses, if you wish to use it as a choice of birth, you're welcome to do so. Your baby is monitored, your baby's heartbeat is auscultated frequently with the nurse, midwife, or as well as the junior doctor would come and listen to the baby and record it and ensure that the baby's heartbeat is in the optimal range. Once the little one is delivered, we would want the baby to be bonded with you, and obviously there's a delayed cord clamping. We would ensure that the baby is crying, moving, and the baby doesn't show any signs of distress, and the baby is put onto your chest. You and your partner are going to enjoy those moments, cuddling the baby, touching the baby, because the baby enjoys the warmth from the mother. So once the cord pulsations are ceased, we go ahead with the clamping and cutting of the cord. And once the first initial suckling is started off, you've given a first feed to the baby. The baby is handed over to the pediatrician to do the initial checkups. Your partner goes along with the baby, stands along with the pediatricians to observe the baby's checkups and all. Once the baby has the initial checkups done with our pediatricians, outside the room, the baby is brought back with you, and then you continue on feeding the baby. So once you've done with your delivery in the birthing suite and the initial checkups are all good, you're shifted back to the room. In the room, the lactation counselor will be coming and guiding you through the lactation process, help you and support you with the techniques to ease off the lactation for you. And the nutritionist will come and talk to you about your diet plans and what are the restrictions or what are the important diets that you should be considering. The physiotherapist will come and give you the insight into the exercises that you need to do, how to keep your body fit and get back in shape once you've gone back home. From the baby point of view, the pediatricians will be coming around and checking on your baby and doing the initial checkups, and the vaccination schedule and all will be discussed with you. The newborn screening will be discussed with you, and the routine care that a baby has to receive will definitely be given to you. When you're talking about water birth, because the medical interventions are so less, it is completely done in such a natural way, you tend to notice the mother recovers much faster. The process itself is an easier process, shorter process as well, and the recovery also evidently is a faster one. It may be the perineal tears are less. That also gives them a lot of comfort in sitting and feeding the baby, not having too many medications to use, no cannulas, no lines and all. So you tend to notice the body feels pretty much as natural as it can be. If you have any cardiac conditions, if you have hypertensive disorders in pregnancy, or your diabetes is uncontrolled, or you tend to notice that you have got any other medical conditions that warrant your baby to be monitored more closely during labor, or the baby conditions, the conditions of a fetus that is like a not a well-grown baby which needs close monitoring, like an IUGR baby or a growth restricted baby. These are the babies. Or if you are identified that your baby is in a breech position, transverse position, or you have twins, these are all probably not the right candidates to be getting into a natural birthing unit or a water birthing unit. So that is the reason that is very important that your doctor goes through the checklist to ensure that you are a right candidate to go through the birthing process without putting you or the baby at risk. Birthing partner plays actually a major role in natural birthing. Birthing partner doesn't just step in only while you birth. We would encourage your partner, your husband, or anybody you've chosen to be a birth partner to be a part of all your sessions from the beginning of your pregnancy, because when you're in labor, when you're in pain, you might forget all what has been taught to you. Your birthing partner is the one who will encourage you to, go through the breathing techniques and to calm you down and support you, because obviously they might remember some of those things. So we, during this process, encourage your husband to be a part of all your classes and sessions, understand what are the dynamics that are going to go through in your body and what are the changes that he has to help you to prepare. And he being a part of your exercises during labor and your mobility during labor and all will be a great support to you. You try to relate more to a person that you are more close to than to the team at that crucial moments. So we would put this, having a partner in birthing suite for your natural birthing process or water birthing process, as a essential prerequisite.